Hi, I'm Brittany Roberts, and I chose to do a paper about teen pregnancy. As of 2013, teen pregnancy has actually decreased, surprisingly, because it has been a huge problem. I know I go to Pedro Menendez High School, and there's like 5 girls that are pregnant, and they're all freshmen, which is ridiculous. So these are the points that I chose. I decided to write a paper that educating teens has provided to be effective in preventing teen pregnancy and should be continued throughout the United States. It should discuss how sex education can be more effective when it comes to teen pregnancy, and then talk about contraceptives, talk about abstinence as the safest option but not always the easiest, explain sexual transmitted diseases, also how organizations can help the rates of teen pregnancy, talk about the main goal of organizations, what the organizations offer. Also, I think the most important is to discuss parents and family members' impact on teens' lives. Family members are always going to be there to support you, if they're your family, definitely, and how a good relationship between a teen and their parents can lower the risk of getting pregnant. Also, I learned that how a religion is important to teen pregnancy. Teens who are involved in church groups have a lower risk of getting pregnant. Also, beliefs and morals can be very important to teens. Also, how to make teen television shows be more effective for pregnancy. They show how hard it is for young parents that have for young kids that have babies at such a young age is so difficult. Explain the everyday challenges that young parents have to go through that other teens don't deal with. Money issues, it's just overwhelming. This is what my paper starts off as. Teen pregnancy is a well-known topic and controversy throughout the United States. Many studies have been conducted to determine the most productive way in lowering these rates. Florida has been ranked 29th out of 51 states in 2010 of girls between the ages of 15 and 19. Out of these teens, it states that 91% are unmarried. What do these numbers really mean, and how can we further improve them? Nearly 1 out of 5 teenagers in Northeast Florida will become pregnant again before leaving their teens. 18% of teen births in Northeast Florida in 2008 were mothers who've had a previous pregnancy. Educating teens have proven to be effective in preventing teen pregnancy and should be continued throughout the United States. Now, the most important part to me is the education. So, teens spend the majority of the year in school, so we must ask what school systems can do to help prevent these occurrences. The dropout rate of teens that become pregnant is a high of 90%. Furthering teens' awareness of sexual education will help to reduce these rates. Providing teens with the knowledge about the risks and facts of premarital sex will help the teens have better judgment when faced with these situations. Discussing the diseases and the risk of pregnancy will inform teens that sexual intercourse is not all exciting as people make it seem. A study shows that teaching abstinence among students has had no impact on actual abstinence. They are led to believe that teaching abstinence will lower the use of contraceptives and by the increase of teen pregnancy rates. 37 states are required to teach abstinence in their schools, and it's not working. Since it has proven to cause more harm than good, schools have stressed more on educating students with facts about sexual intercourse and supply students with access to contraceptives and condoms. Well, for instance, my best friend had an abstinence ring, and she was 14, 15, and then when she hit 16, she got a real serious boyfriend, and that ring no longer existed. Furthering the discussion on educating students in schools, the emotional toll should also be greatly stressed. Students are engaging in sexual intercourse at an early age and more frequently. This is taking a high emotional toll on many. WebMD states that girls are especially vulnerable to negative emotional after effects. A large percent reported negative consequences such as feeling used, getting pregnant, getting a sexual transmitted infection, or feeling bad about themselves. Informing students that these heavy emotions could reduce the number of teen engaging in sexual intercourse and by that reduce the teen pregnancy rate. There are many organizations whose main concerns are in preventing teen pregnancy. Planned Parenthood is a good program that will help teens find the proper information to make a decision whether to engage in sexual intercourse. Planned Parenthood will provide things such as birth control, condoms, and information, as well as drastic measures such as abortion, without the consent of a parent. Planned Parenthood's goal is to provide reproductive health care to all people requesting such services, to educate the community in all areas of responsible human sexuality. Advocates for Youth helps young people make informed and responsible decisions about their reproductive and sexual health. Advocates for Youth believes it can best serve the field by boldly advocating for a more positive, realistic approach for adolescent sexual health. Teen Pregnancy Prevention Alliance was established in 1994 as an action group of the Healthy Start Coalition of Hardy, Highland, and Polk counties. Teen Pregnancy Prevention Alliance, also known as TPPA, is an organized group of social service providers, educators, faith leaders, healthcare, business parents, and teens committed in creating environments that supports parents and empower youth to maximize their potential without limits imposed by pregnancy, childbearing, and parenting. The Alliance has a structure to follow to help teens. The structure is steering, which provides direction and determines Alliance activities; community awareness, which operates to raise the awareness of impacts of teen pregnancy; effective programs and research that studies effective programs for implementation; religion and public values that encourage faith leaders to take action against teen pregnancy; and youth leaders teams, which is comprised of youth under 18 who are either practicing abstinence or sexually responsible lifestyles, to give a voice to the unique perspectives and opinions of teens throughout the county. The main point that this organization brings up is 3 out of 10 teenage girls in the U.S. get pregnant at least once before age 20. Almost 50% of teens never consider how teen pregnancy would affect their lives. Parenthood is the leading reason why girls drop out of high school. 8 out of 10 fathers do not marry the mother of their child. Sons of teen mothers are twice as likely to end up in prison. The Teen Outreach Program is also a good organization. It offers free pregnancy testing, teen parenting classes, teen pregnancy prevention, and teen pregnancy education. The best thing they offer is the DAD program, because most organizations do not stress on the dads, only the moms. In the DADS program, they offer a counsel group that is for not just for teens, but also they talk about the experience, the same thing, and they discuss how they handle things differently. Also, this organization offers classes to help the parents of the teens. The main goal of this organization is for teens to feel safe and supported for everyday decisions that is made concerning the child that is about to be brought into this world. At this organization, it offers a special counsel group where one can refer a friend that has become pregnant and does not know what to do. The counselors would help this friend tell the teen that the pregnant options they suggest, and if pregnant teens need help, there would be no problem to come and talk without their parents knowing. Out of every organization, this one offers the most wide selection of help. Family and parents are often forgotten in the effort to properly educate teens. The parent-to-child relationship can greatly impact the child's decision in engaging in sexual intercourse or not. In the article, Parental Influence in Teen Pregnancy, it states that parents have a huge role in their children's decisions about sex. There's plenty of research that came to that conclusion. The quality of parents' relationships with their teenagers can make a real difference in the decisions that their children make about sex. Children in a single-parent family and teens with older brothers and sisters who are sexually active are more likely to be sexually active at an early age. Teens in households with poverty, crime rates, and unemployment are also likely to start having sex early without the proper use of protection and birth control. I personally 100% agree with this. My brother is 4 years older than me, and I think I didn't go about sex the proper way. The United States has become less religious in the late 20th century and the early 21st century. Research shows a positive relationship between religion, beliefs, and teen pregnancy. There is a wide range of possible reasons for this relationship. Both religion and teen pregnancy are linked to poverty and lack of education. In a report released in 2001, Keeping the Faith, the role of religion and faith communities in preventing teen pregnancy, teenagers indicated that their morals, values, and/or religious beliefs were more of an impact on their decision whether or not to have sex than worries about STDs and the fear of getting pregnant. Sharing religious beliefs, views, and morals are very important with teens. If teens have a way to attend religious services, involve family in religious studies, or having a family prayer time helps teach children's beliefs and allows them the space to question their own beliefs in a safe environment where they can explore. Religious intolerance of teenage sexuality can be undesirable consequences for teen birth rates. Almost every teenager watches television. I know I watch it at least most hours of the day. There's already a show out there on television called Teen Mom and also 16 Pregnant. These shows have opened a lot of younger girls' eyes to see that having a baby with a teen boy, whether it's planned or not, is very difficult. According to a new government study, U.S. teen birth rates plunged dramatically in 2009 after a 5% increase from 2005 to 2007. In a report by National Campaign to Prevent Teen and Unplanned Pregnancy recognizes 16 and Pregnant specifically that 82% of teenagers credit the hit show in helping them understand the challenges that come from unexpected parenthood. In Teen Mom, there are 4 girls. In each episode, it shows the problems, complications between the mothers and fathers, their financial problems, and overall the stress they go through, since most of the mothers on there are trying to go to school, work, and be a mom. When teens watch this show, they should see how hard it is to do what they do and should not want this to happen to them. This is the whole point of the show. At the end of the season, the parents off of Teen Mom get together and talk about their problems and struggles with Dr. Drew, who started the show. Dr. Drew makes sure he stresses on every issue that each teen has been through, such as the father of the baby not being there. Also, the main issue has been financial problems. Most of the moms have dropped out of high school because the stress of being a mom and working is just overwhelming. The problem is that there is only one show like this. It mainly appeals to girls. There should be more shows out there that show the life of pregnant teens after the baby is born and the mother is horrible, so the father has to take care of the child. Maybe that would make the show more appealing to teen boys. Who knows? They're too difficult to understand. There could also be a negative side to a show like this. There could be a happy couple that have it easy, such as the teen mom and teen son. The teen soon-to-be father does not have to work because they're rich parents and they only have to go to school and be a parent. Their life looks easy and great with a couple of everyday issues that every relationship has. When teens see the good part, they could say, oh, it'd be easy to be a teen parent, no big deal, and actually plan it to happen. But overall, a television show, if there was another one to come out, should be more positive than negative. Even though teen pregnancy rates have come down in the past few years, it's higher than it should be. Things need to be done so the rates keep dropping and these issues can come under control. If the school system started to crack down and put more effort into teaching about contraceptives and the emotional toll teen pregnancy causes, we'd be one step closer to being under control. Organizations can be quite helpful as well. If a teen is thinking of becoming sexually active, they should consider volunteering at one of the organizations to see what the teens that have gotten pregnant go through every day. Family and parents can be very informing and help lower the teen pregnancy rates by being supportive and standing by their teens even when they make the wrong decisions. If a teen feels close to their parents, it has been proven that teens are less likely to make decisions they know will bother their parents and more likely to make decisions that will make their parents proud. I am personally one of those kids. I disappointed my parents, and I have made sure not to do that decision since. I am very close to my parents. They mean everything to me, and I hope that every kid out there feels the same. Not to mention, religion has decreased as of the 20th century, which has greatly affected the teen pregnancy rates. Last but not least, the other way to help teen pregnancy rates would be to show them what life would be like having a baby so young, which is done by the show Teen Mom. If there are more shows that got teens' attention, maybe they'd think twice about having unprotected sex or sex at all. If all these tactics were discussed and put into action, teen pregnancy rates would drop. And I completely agree with that. Well, I hope that you agree with my paper.